Hello everyone, welcome to the Nursing Students channel on YouTube. Here we talk about everything nursing from academic to our researches and every other thing concerning nursing. If you're a new member, kindly hit the subscribe button and then hit the notification bell so that you get every new video that we do. And if you're an old member too, then you're welcome. Enjoy the class. Today we're picking the baton from where we ended the last time. So our topic still remains as introduction to the nursing diagnosis, but then the part 2 of the previous one. So we are going deeper into the nursing diagnosis. Let's kick start. So let's go straight to the nursing diagnosis. We have types of nursing diagnosis. We have about 5 types, but then academically we are focusing on only two for now. We're focusing on only two, even though I'll give you all the 5. All the 5 are the actual nursing diagnosis, which is problem focused. We have the risk nursing diagnosis, which is potential problems. We have health promotion nursing diagnosis, and then we have syndrome nursing diagnosis. Another nursing diagnosis is the possible nursing diagnosis, which makes it 5. But for our criteria, we are going to focus on actual and then risk nursing diagnosis. Sometimes we are going to add the health promotion diagnosis also. So we're taking the actual nursing diagnosis first, and it is basically what is actually existing now. Okay, so they're like actual situations, actual problems. Does the patient has a headache? Yes. So if the patient has a headache, then it is an actual problem. So it exists currently. Okay, and then it is the nursing diagnosis that we use the 3 parts. The 3 parts and the 2 parts will come later, but then let's just briefly brush through it. We use the 3 parts nursing diagnosis for, okay, because we have the problem, we have its relating factor, and then we have its manifestations, okay. So you normally use the 3 parts problem for them. And examples, we have anxiety, we have infective breathing pattern, we have acute pain, we have impaired skin integrity. So basically anything that exists currently, that a patient is going through currently, that a patient is experiencing currently, is an actual problem. Okay, and then we use the actual nursing diagnosis for it. The second one is the risk nursing diagnosis, which is like potential problems. Potential problems are more like problems that can happen but do not exist right now. So they're like problems that can occur if you don't do something about it. Okay, but then it hasn't occurred yet. For example, risk for falls is a potential problem. A patient suffering from CVA or a patient suffering from epilepsy has a risk of falling. Okay, so risk for injury that is falls comes here, but then it doesn't mean that the patient has fallen. Are you getting it? So the patient hasn't fallen yet, but the patient has a potential to fall if you don't put in measures to prevent that falls. So basically risk problems or risk nursing diagnosis focuses on preventing the occurrence of the problem, whereas the actual nursing diagnosis focuses on addressing the current problem or existing problem. The third one is the health promotion diagnosis, which focuses on the desire and motivation. So it is basically only one component. I forgot something. The risk potential focuses on using the two-part nursing diagnosis component. Okay, so the actual uses the 3, the risk uses the 2, and then the health promotion uses the 1. The syndrome also usually uses the 1, and the possible also uses the 1. You'll get to understand the parts that I'm talking about when we go a little bit further. So the health promotion basically focuses on, improving the patient's stage and the patient's health, the patient's personal experience, okay? So examples include desire and motivation, okay? So patient's desire to learn, patient's desire to take care of himself, patient's desire for health, self-care, patient's motivation to eat, patient's motivation to do something. Okay, so that is the health promotion. So it's basically focusing on the patient's health at a goal. So it's basically a one part nursing diagnosis problem. And then we have an example as readiness for enhanced parenting, and then that is all. There is no related to, there is no manifested by. Okay, and then an example too is readiness for enhanced family coping, readiness for enhanced self-care. Those are examples. We don't have relating factors and we don't have manifestation factors. Okay, then the other one, that is a syndrome, it basically deals with a cluster of different problems. Okay, so we don't have a specific problem causing something, but then a cluster of different problems. And then the possible nursing diagnosis is also one part. It describes a suspected problem without enough data. So it's unlike the risk, which has a potential problem or a potential situation occurring. The possible is like it can happen, but then we don't have any data. Okay, we are suspecting that this is what is happening or this has happened, but then we don't have any data to, support our claims. So we just keep it as a possible statement. That is why usually it is not considered as one of the nursing diagnoses, like actual risk health promotion. So the components of the nursing diagnosis, we have three components of the nursing diagnosis. We have one, the problem, which goes for P. We have two, the cause or the etiology, which goes for A or E, depending on which type of English you are using. But I am using etiology, which starts with an A. And then we have the defining characteristics, which goes with S for signs and symptoms. Defining characteristics is the same as signs and symptoms, so I use S for them. Now, let's take them one after the other. We are taking the problem first. Now, the problem has two parts. The problem, that is the P, has two parts. It has the first, a qualifier or a modifier. The qualifier or the modifier is like an adjective that describes the problem existing. Okay, so the qualifier or the modifier describes the problem or modifies or qualifies the problem. Okay, so for example, a patient that has a breathing impairment or a breathing difficulty, we start with, let's say, impaired breathing, ineffective breathing. You get it? So impaired breathing pattern or ineffective breathing pattern. So the modifier or the qualifier in this statement is the impaired or ineffective. So a patient with nutritional deficiencies, we're going to go with imbalanced nutrition. The imbalanced becomes the modifier. That is the A part. So examples of qualifiers or modifiers, we have the deficient, we have ineffective, we have imbalanced, we have risk for, and then we have impaired. Then the B part of the problem is the problem focus itself. So we have the qualifier or the modifier, and then we have the problem focus. So the problem, let's say, is the breathing pattern. The problem can be fluid volume. The problem can be gaseous exchange. The problem can be nutrition. So imbalanced nutrition, the imbalance becomes the qualifier or the modifier, and then the nutrition becomes the problem focus. So our focus or our problem is the nutrition. Okay, but the modifier or the qualifier is the imbalance. And together, these form the first component of the nursing diagnosis, which is the problem. So you're going to see something like deficient fluid volume. Deficient is the qualifier, and then the problem focus is the fluid volume. Let's go to the next one, the cause or the etiology. The etiology is more like what is causing our problem. That is what is causing A. The one is problem, the two is the etiology or the cause. So the etiology is what is causing the A or the one, which is the problem. So it has a conjunction, and that conjunction is a related to. Related to. Just like we have English words, for example, the fanboys, which is a mnemonic for the 7 conjunctions to conjugate sentences. The 7 conjunctions are the for, and, no, but, or, so, yet. That is how the nursing diagnosis also works. We use conjunctions to join or conjugate those two words together. So we have our problem, which is impaired breathing pattern. The cause or etiology is joined to it using the conjugation related to. Okay, so our problem is related to the cause or the etiology. Are you getting it? So we have situations, we have risks, we have possible outcomes, okay, all being related to the problem. So if we are taking, let's say, imbalanced nutrition as our problem, we're going to say imbalanced nutrition less than body requirements, meaning the patient is not eating well, or the patient is lacking, or the patient is malnourished. So if imbalanced nutrition less than body requirements, what is causing that? That becomes our cause or the etiology. And so to join it, the cause could be, let's say, loss of appetite. So to join it to our problem, for cause our problem, we have to bring the conjugate related to. So we're going to end up getting imbalanced nutrition less than body requirements related to loss of appetite. Are you getting it? So imbalanced nutrition less than body requirements is our problem. Its relating factor or its cause is the loss of appetite. So imbalanced nutrition less than body requirements related to loss of appetite. That is our first two parts of the nursing diagnosis. The last part, which is the defining characteristics, comes in to qualify everything that we've said. We are saying that the patient is malnourished as a result of not eating. So what is showing you, the nurse or the medical doctor or whoever is there, the healthcare professional, that the patient is actually malnourished? That is what comes in the defining characteristics. So if it's an actual problem, then of course you are supposed to get a defining characteristic. So we have imbalanced nutrition less than body requirements related to loss of appetite. Now we have to join the defining characteristics, and here our conjugate is as evidenced by or as manifested by. So imbalanced nutrition less than body requirements related to loss of appetite as evidenced by or as manifested by. So it's more like we can see that the patient is malnourished because he's not eating since. Are you getting it? So the sense is going to tell us what you saw to make you think or believe that the patient is malnourished. So if the patient is malnourished, the patient can be weak, he can have low desire for work. So if we want to link those two evidences to our statement, we are going to have imbalanced nutrition less than body requirements related to loss of appetite as evidenced by low energy for work and then general weakness. Are you okay with that? So imbalanced nutrition less than body requirements related to loss of appetite as evidenced by or as manifested by, you can use any one of them, as evidenced by low energy for work and then weakness. That makes your statement about the patient's eating habits and eating states complete. So anyone that picks your notes is going to realize that the patient is weak because he's not eating well, and he not eating well is not giving him enough nutrients to energize him to do the things that he's doing. So if I come to the ward and the patient is lying in bed feeling weak, I'm going to understand that the patient is weak because he's not eating. And once he's not eating, then he's not getting enough nutrients to energize him, because we need glucose to be active. So whoever picks your note just reads this statement and understands a whole lot about the patient's general well-being. That is how powerful the nursing diagnosis, if it is only applied well, can be. So then how do we get our data, or how do we get our problems, our statements? We have the diagnostic process that we use in getting all our data and then formulating our diagnostic statements. The diagnostic process is a 3-step process. First of all, we have the data analysis, then we have the identification of health problems, the risk, and then the strength, and then the last one is the formulation of the diagnostic statement. At this point is where we are going to go deeper into the 2-part statement and the 3-part statement of the nursing diagnosis, but that will be another time. So for today, we are only ending here at the components of the nursing diagnosis. So God willing, another time we are going to start with the data analysis and then the diagnostic process. But then before that, we have some variations to the nursing diagnosis, which we are going to do in the next video. But then for today, we are ending here. So stay safe, have a nice life, and keep learning. See you in the next video. Bye bye.